It's kind of an interesting concept. But again, is this too idealistic for mainstream America? I mean, it might work in Marin County or Los Gatos, but really will it work in East San Jose, Oakland, or Concord? That's my questions about these concepts that I'm presenting. So again, I want you to understand that these are only being presented as points of discussion, and what can we accept as something really workable for the future. Again, we talked about how we can increase more people on the issue of insurance, being covered by insurance. And a lot of it has to do with direct payment by the patient, so that we have a higher deductible catastrophic plan. And also, you know, it's interesting, but we always complain about not having vitamins covered and visits to chiropractor covered, or even visits to alternative practitioners covered. Well, now you have the money in your pocket. All of a sudden, now you can have these covered as a tax deduction that your employer is paying for. So this is kind of an interesting new opportunity to use the same insurances that normally wouldn't cover these things as a vehicle for providing the alternative services. And then obviously increase provider competition for these services. We're going to go back to the issue of transparency. The minute people start to find out what it really costs to do an x-ray, or to do a surgery, or to pay for a piece of equipment or medication, all of a sudden all of the providers are going to have to be accountable as to why they're charging more than another. And this happens in the everyday marketplace. And this is why the computers that we buy tomorrow are cheaper and faster and better than the ones we bought yesterday, because competition and the market forces are at play in attracting the consumer dollar. And so I think that one of our goals, not only from our private practice point of view, but from these forum series, is to really expose what the real problems are, what the real costs are, and then possibly have this ripple effect, so that now the discussion turns to the quality of health care, not the cost of health care. We have to look at a health-oriented wellness model. In other words, personal responsibility for your health and how you're going to prevent disease and prevent complications and prevent needing to go to the healthcare system, because now the responsibility is shifted toward the patient, not an insurance company who's going to pay the bill for you. You're going to know the costs and the risks associated with treatments and diagnosis, and you're really going to be more concerned about if this treatment is going to help you or not. One of the interesting things about our practice is that we tell a patient, look, this might cost you $500, but it's going to work. And people don't have any problem with being told those two things. One of the things that employers may need to do is help employees learn about disease and illness, because obviously we hear about the billions of dollars that certain conditions waste in the workplace, whether it's menstrual cramps or headaches or migraines or just having a bad diabetic day causes. So it's going to be a new concept where instead of just providing you the insurance, all of a sudden maybe the employer should get involved in healthcare knowledge distribution. Incentivizing healthy behavior. This is very idealistic. You know, some companies, remember, they used to have the gyms in their companies, and encouraging people to take a jog at noon, and maybe even tie that to getting a raise if they maintain their weight or blood pressure. So those are the kind of things that are just too general, I think, to expect everyone to be a part of. But I think that it should be on the list for employers to think about incentivizing their employees. Implementation of health management programs is a concept which I've been toying with in the practice, where do we all of a sudden try to develop a bigger program, not only in our practice, but a community-wide program to help out with problems like diabetes and hypertension, just like the effect that we had with smoking cessation. That was really a big undertaking, and I didn't think it was going to be successful when it started out 20 years ago. But the fact that the governments got behind it, consumer groups got behind it, even reluctantly employers got behind it, I think it's been a tremendous success, not only in terms of the cessation, but in the secondary results to the healthcare for all of us. And the incidence of lung cancer and those complications have all gone down. So that last one is a very big one in terms of maybe the society looking at it and working at it from the point of view of cooperation from employers and government and doctors and patients, because we know that the big three are a problem that we can take care of, like diabetes and obesity and hypertension. These things almost are in the same realm as smoking cessation. There's a lot of misconceptions about doctors. They're saying that doctors fall behind because technology is going too fast. Medical knowledge is just too much, it's overwhelming, and that doctors don't like to make changes, especially with new technology. They like to stick with the old ways and really are reluctant to have any changes. And that the doctors, they don't quite understand how doctors interact with one another. And people don't understand why doctors don't like anybody to tell them how to treat a patient. So all of these negatives really are a product of lack of consumer responsibility, and also the third-party payment system, and also frustration with a high cost. Just as we all learn how to use the internet and how to use the new programs and how to use the new editing videos and how to use the new systems for exercise equipment, I don't think there's any difference between that and what physicians can do in learning new technology. There is no difference. In fact, as we saw with Dr. Newman's new invention, that now puts more power into the doctor. Now that invention should take off real quickly because doctors really need that. How can you imagine a doctor not wanting to have that technology in his office to help make a diagnosis? But according to the belief is that, well, that'll never happen because doctors just don't want to accept any change. So the medical knowledge, I mean, we're constantly building on our knowledge every day. Every day we read, every day we attend programs. So we're building on a system, not reading. I wanted to just add that vitamins and vitamin supplements are traditionally not really talked about by physicians or other medical practitioners because, again, the lack of knowledge. And so this is one of the purposes of our forums, is to begin to become aware of what patients are using, where they're obtaining them, and being able to have the information that makes sense to them so that they can make their own decisions. Just like the physician has to make their own decision as to whether they're going to recommend or provide one of the nutraceuticals or food supplements. So with that, I wanted to thank you for coming.